Hey, this is Angeline Ross Cole, first year nursing student. So I will be performing the skin, hair, and nail assessment for this video. So the first thing we need to do is to review the medical records, and this allow me to get the basic information about the patient and also the scope of the assessment needed. And we need also to prepare the necessary equipment prior to meeting the client. So, a little trivia: the skin is the largest organ in our body and it belongs to the system of called integumentary system. It means that outer cover of our body, which is serves to protect us from hazardous substances, and some certain diseases or illnesses often manifest themselves through our skin. And that is why we need to take care of our skin and perform skin assessment. Now let us read the chart of the patient. Okay. Now I'm going to read the chart of the patient and for the confirmation. So my patient is Hershey Ross Cole. Her height and weight is normal, and also her body mass index is also normal. Now that I am done reading the chart of the patient and I already prepared with my paraphernalia needed for the assessment, now let us read the patient. Hey, how are you?
I'm good.
That's nice. Okay. I am Angeline Ross Cole, your student nurse for today. And but before that, I am going to perform a high hygiene first, so that to prevent cross contamination. Um, I would like to confirm you are Miss Hershey Ross Color, right?
Yes.
Alright, what do you want me to call you?
Hershey.
Okay. Miss Hershey, I would like to ask for the verification. Um, when is your birthday?
January 1, 1997.
What about your age?
25.
Okay. Okay. Alright, Miss Hershey. Okay, basically I am going to assess your hair, your skin, and your nails. And in order to do that, I'm going to touch some parts of your some parts of your body, certain parts, and I would like to ask if it is okay to touch some parts of it.
Yes, it's okay.
Rest assured that um, the data that I will be obtained will be confidential between me and to the referring doctor. Okay, but okay, I'm going to ask you some questions regarding about your current condition. Is it okay?
Yes.
Okay. Did you experience itchiness?
No.
No. What about rashes?
No.
No. How about dryness of the skin?
No.
Oiliness?
I don't think so.
You don't think so. Okay. Is there changes in your skin?
No.
No. What about changes in your nail?
Nothing.
Nothing. Okay. Is there in your family having skin disease or skin cancer?
No.
Okay. So about your current lifestyle, how long do you usually expose yourself from sunlight, or usually how many hours?
I think it's 2 to 3 hours.
2 to 3 hours. Okay. Is there anything stresses you?
As of now, none.
Okay. Okay. If is there any clarification that you want to ask me?
Nothing.
Okay, nothing. Okay. Okay, Miss Hershey, I asked you earlier that I asked you earlier about consent to touch certain parts of your body, but before we start our assessment, please wear this gown and remove all your jewelries, and I will meet you after. Okay, let's assume that the patient is changing her clothes, and while she's doing that, we're going to provide our patients privacy. Okay, we're going to close all the curtains, and also we need to perform hand hygiene for or to prevent cross contamination, and we're going to wear our gloves. Okay, ma'am, Miss Hershey, may I see your um, hair or scalps for any lashes or dandruff? Okay. I obs- okay. I observed that the hair is evenly distributed. The texture is good. The moisture is good also. I don't see any lashes or any dandruff. So basically, I am just inspecting and palpating our patient's hair in the hair. Okay. Okay. After the hair assessment, we're going to remove the gloves and dispose it in the infectious dustbin. Okay, let me record it first. Okay, your hair is evenly distributed. I don't see any scars, no dandruff. The moisture is good, the texture is good, and the lashes, or there's no lashes and there's no scars in your hair. Okay, proceed to our skin assessment. Okay. Um, Miss Hershey, can you do this for me? Okay. You. The patient's skin is normal. Okay. Patient's skin, I don't see any unusuality, discoloration, and her skin is there's no. I'm not noticing any hyperpigmentation. The skin is unhyperpigmented. Any or any unusualities, discoloration. Wait, let me transfer. And also, I don't see any yellowish in her skin, which is good because there is no abnormalities. Okay. Okay. Then I'm going to palpate the patient's skin using my using the dorsal surface of my hand. Dorsal surface. This is very useful to the nurses so that they can measure. They can obtain an accurate measurement to the patient's temperature, the textures, accurate textures, moistures. Okay. Let me just. Okay. temperature of our patient is normal, and the moisture is good, the texture is smooth, her skin is not so dry and not so oily. Okay, now um, after the after that, let's assess our patient's skin mobility and turgor. Okay. Okay. Let me pinch it. As what I have observed, when I pinch the patient's skin, it went back or it returns back to its normal mobility. Okay. And also I observed that the when I pinch, the trigger is elastic, which is good also. So there's no sign of or for edema. Okay. The next is let's go into okay. And also we're going to put some pressure here. We're going to pinch or put some pressure here in 2 centimeter, in 3 centimeter, and also in 4 centimeter. And we notice that the patient's skin is um, went back or returned back, which is also good because there's no sign of edema. Okay, okay, okay. Miss Hershey, your skin is normal. The moisture is good. The texture is smooth. Your it's not so dry and it's not so oily. Your skin is consistent. There's no yellowish on the skin, and skin moisture is normal, just like what I've said. Your skin is warm. It's normal, warm or normal temperature, and when I pinch your skin, it returns or the mobility is normal, which is good because it means that you are hydrated. Okay? After that, after the skin assessment, let's proceed to our next assessment, which is the nail. Okay, Miss Hershey, can you do the? Can you raise your hand? Okay. Okay. I don't see any fungal infections, which is good, and your hands and your nails are clean. Okay, Miss Hershey, can you do this for me and form like a diamond? Liz, can you do this? Just like yes, just like that. Okay, and just like that, and then now let's proceed to assessing the nails, the nail texture of our patient. When I pinch it here, the capillary filiard, it immediately returns to less than 2 seconds. Okay, let me take note about this one. Okay, okay. Your nails are hard and firmly to the nail bed, and I'm not noticing any fungal infection, and your capilla feel returns 2 seconds or less than 2 seconds to pink tone, which is good. Okay. So, Maurice Hershey, I don't see any abnormalities on your skin, your hair, and in your nails. So, I guess that's it for today. Okay, thank you.
Thank you.